Thank you to everyone for joining us for today's webinar. I'd like to thank the funders of Cochrane Canada, without whom these webinars, our training, systematic reviews, and capacity building could not happen. Thank you to CIHR for their support. I'd also like to thank PAHO for kindly providing the software for our webinars, and a special thank you to Luis Gabriel Cuervo, who produces videos for our webinars that are located in the Canadian Cochrane Centre's webinar archives. Without further ado, I'd like to introduce today's webinar on the Cochrane question, presented by Teresa Marin, who is the Managing Editor for the Cochrane Back Group. Teresa graduated with a doctoral degree in health psychology from the University of British Columbia in November 2010. Her research examined the impact of psychological stress on biological outcomes, such as cortisol and markers of systemic inflammation. Teresa has received a number of honors for her work, including a senior graduate scholarship from the Michael Smith Foundation for Health Research and a Canadian Institutes of Health Research graduate scholarship. She has published articles in Health Psychology, Psychosomatic Medicine, and Psychological Bulletin. Teresa has joined the Cochrane Back Group as Managing Editor in September 2011. Thank you very much for being with us here, Teresa, and I'll get you to go ahead.
Great. Thanks so much, Eileen, and thanks to everyone for joining today. So as you know, today we're going to be considering the Cochrane question and give you some practical tips for getting a review underway. Okay, so to begin with, I'm just going to go over the various steps of writing a Cochrane review. And the initial stages are all about planning, and this is what we're going to be focusing on today. So defining the research question, planning your eligibility criteria, and planning the methods. And it's only after you've done that that you'll publish your protocol in the Cochrane library, and then you can actually get started on the review. So you can conduct your literature search, you find all the important information that you need to from the trials you're including in your review. You can do an assessment of all the studies, analyze the results, and eventually publish your conclusions in the Cochrane library. And as you know, it doesn't end there, because we aim to update our reviews every 2 years. So today we'll really just be focusing on these first steps, and you'll see how important they are to setting the stage for the rest of your review. So we're going to begin with an overview of review questions, and then we're going to deconstruct the Cochrane review question, and then we'll spend a short amount of time talking about what to include in your study protocol. So there are various types of Cochrane questions, and the most common questions are questions of intervention efficacy and effectiveness. So does the treatment work or not for a particular condition? Now the Cochrane Library also publishes reviews of diagnostic test accuracy, prognosis, and methodological reviews. However, these aren't quite as common, and not all review groups actually produce these types of reviews. So if you have an interest in one of these areas, then it's really important to contact your relevant review group early in the title registration process. Now, Cochrane does not produce reviews of incidence, prevalence, or association. If you have an interest in this type of review, you may be able to use some of the Cochrane methods and guidelines to inform your review strategy. However, you won't be able to register your title with a review group or publish in the Cochrane library. You'd have to publish in another journal. So for today's presentation, we will focus on Cochrane intervention reviews. Now, even Cochrane titles have a standard format. So first we specify what the intervention is, and then we specify what the actual issue is. So two examples, antibiotics for acute bronchitis and community-wide interventions for increasing physical activity. So closer to the end of the webinar, we'll come back to this and talk about how we can turn your topics of interest into Cochrane questions. Okay, so once you have an idea for your topic, it's time to define your research question. And this is an essential first step for your review. It guides so many aspects of your methods. For instance, it helps you to determine your eligibility criteria. And these criteria help you to make decisions about studies that will be included and studies that will be excluded from your review. Now, the research question also informs your search strategy. So this is the strategy for your literature search. So if your research question is unclear, you may miss findings that are of interest to you, or you may find a bunch of studies that just aren't relevant to what you're actually interested in. Now, your question will also help to guide your data collection and your analysis. It will help you decide on your outcomes of importance, and it will help you decide on what information you need to find in the included studies. So think carefully in advance and plan your work. This is going to be the theme throughout this presentation, because what we're trying to do when we're writing a systematic review is avoid bias. So if you're making a bunch of last-minute decisions on the fly, these have the potential to be influenced by the results of the studies that you're including in your review. So you want to avoid that. And so that's why you'll probably, when you start your review, you'll probably spend a lot of time on planning. It will pay off later on. Now, of course, sometimes it's necessary to make changes to the scope of your review or your research question. And when this happens, the most important thing to do is discuss it with the Cochrane Review group that you're working with. Okay, so as you're thinking about your topic and scope, you should also really consider whether you're addressing a question of importance and relevance. So does the health issue that you're interested in have an important disease burden at the level of the population and the individual? And does this intervention that you're interested in have the potential to really reduce this disease burden? And you'll want to consider all important stakeholders. So consider anyone who may be affected by the intervention. So this includes consumers or patients, health professionals, and policymakers. And you want to address real questions faced in decision making. So say you're really interested in a new intervention. So you have to think, will it be more useful to compare this intervention to, say, a no intervention or a placebo? Or would it be more useful for people to know how this new intervention compares to the currently available treatment options? And finally, as with everything we do in the Cochrane collaboration, it's important to consider an international perspective, because the burden of specific diseases may vary greatly in different countries or different populations. So another aspect of your review question is how broad or how narrowly it's defined. So let's start with an example of quite a broadly defined review question or topic. So say interventions for drug and alcohol addiction. Now this is broad because interventions for drug and alcohol addiction could include any type of intervention. It could be pharmacological, psychological, educational, spiritual, or religious, and those are just to name a few. So what would be the advantages of having such a broad review? Well, the review would be comprehensive and it would be generalizable. But on the flip side, it might be rather long and complex. And because there are so many included studies, potentially, the review authors may miss important subgroup effects. So maybe you want to hone in and get a little bit more specific. So say you want to focus just on spiritual and religious interventions, say for drug addiction. So what would be the benefit of narrowing this research question? Well, the review would be easier to write, easier to read, easier to update. And this is important because we have to keep our Cochrane reviews up to date. However, you would also need multiple reviews to cover this area of interest, and each review may be selectively defined. Now, there is really no right or wrong answer when it comes to how narrow or broad your question is. It really depends on your area of interest. And if a Cochrane review group does publish multiple reviews, multiple narrow reviews on a given topic, then there's always the option to write an overview of reviews. And these are brief papers that summarize the findings of multiple related reviews. So someone could go into the Cochrane library and really get the big picture of what's going on for those types of interventions for that population. Okay, so now that I've given you an overview of review questions, we're going to talk about the components of a review question. And we're going to use this, do this using the Pico concept. So have any of you heard the Pico format before? If you have, you could write a little note in the chat room. Let us know. Oh, that's great. Amanda's heard of it. Karen? Yes, yes. Okay. So this is familiar to people. So do you want to give us some details about it? What does it stand for? Pico. You could write into the chat window. See some people writing. Population. That's right. Intervention. Exactly. Comparison. Okay, one more. Oh, okay. We've got them all now. Thanks, everyone. It's a great start to your participation in this. Okay, so as many of you already know, the components of a research question include the population, intervention, comparison, and outcomes. And so when you're defining your research question, you want to look at each of these components in detail. So for example, say you're interested in yoga interventions for chronic low back pain. Patients with chronic low back pain, that will be your population. Your intervention is yoga. And then, well, the comparison isn't specified in the title, but you would probably compare your yoga intervention to maybe other active interventions or treatment as usual. And then you would have to decide on which outcomes will tell you which intervention is most effective. So if you were looking at chronic low back pain, you'd probably be looking at outcomes such as pain and function, for instance. Okay, so once you've considered each of these components, you also want to consider variations that you may wish to explore in the review. So for instance, in this yoga example, you might be interested in the fact that there are many different types of yoga. So you might think of whether you could explore whether some types of yoga are more effective than others for individuals with chronic low back pain. So now we're going to go into the population in more depth. So you'll want to give a clear definition to identify people of interest. So in the example I've given, we're talking about people with chronic low back pain, so you have to define, well, what do you mean by chronic? In our group, we consider that to be pain with a duration of 3 months or greater. And you'll also want to consider, well, who made the diagnosis and how were the patients in the study diagnosed? You'll also consider population and setting. So say you're interested in individuals with drug addiction. Are you looking at an inpatient setting or an outpatient setting? These are all things to consider when you're defining your population. Now, any limits on your population should have a very clear rationale. So say you decide you're going to look at a very specific age group or only one specific stage of a disease. There should be a reason why you're doing this, and probably because you think the treatment effect will differ in that subgroup of people. Now, your other option is to include, say, a wide range of ages or multiple stages of a disease, and then you can actually investigate that further in your review by doing subgroup analyses. Okay, so something you're going to come across when you're looking at studies for possible inclusion in your review are mixed populations. Okay, so and this means that these are studies in which only some participants meet your criteria. So say you want to look at individuals up to the age of 16 years, but then you find a study that seems quite relevant to your research question, but they include individuals up to the age of 18 years. So some of those people don't strictly meet your eligibility criteria for the population. So let's really stop and think about this. What are you going to do? How strict are you going to be about your inclusion criteria? Now, there are a number of possible ways of addressing this. And you have to decide which way is most consistent with the aims of your review. So the first option would just to be include the whole study. Say, well, the majority of participants meet my inclusion criteria. I don't want to lose the data from that study just because we have maybe 15% of the population is over the age of 16. So you can make that decision, and you won't lose any information about those people who do meet your criteria. Now, the second option is to only include those individuals who do meet your criteria and try to separate out the information from the report you're looking at. So this means you might have to contact the authors to see if they can provide you with this specific information. Because for instance, it's unlikely that in the paper you're looking at that the effects will be reported just for individuals 16 and under. It will probably include the whole sample. So if you can get your hands on the data, that's really helpful, but it's not always possible, especially if it's an old study. Now, the other thing you can do is you can decide that the risk of including some inaccurate information in your review from ineligible participants outweighs the benefit of including the study at all. And you can just say, nope, not everyone meets my criteria. That study will not be included in my review. So as long as you plan and justify how you will deal with this to begin with, then any of these options are perfectly fine. So another consideration is whether issues of equity and relevance to specific populations are important to the review. So you want to consider factors like sex, age, ethnicity, economic status, and education. Now, why are these factors important? Well, depending on the population, there might be a different prevalence, progression, or impact of the disease. For example, in the Cochrane Library, we have a title of a review, and it's called Antibiotics for Sore Throat. Now, this may not be a useful question in high-income settings where the impact of a sore throat is just not that great. However, in some low-income countries, there's a higher likelihood of progression to rheumatic fever with serious complications. So suddenly, this becomes a very important and relevant research question. Now, depending on the population, we might also see different effects of the treatment or different issues related to harms and adverse effects. So for instance, say you're interested in an educational intervention. You might think about the fact that the effectiveness of this intervention may differ across different cultural settings. And finally, depending on the population, there might be different outcomes of importance. For instance, if you're looking at children, school attendance may be a very important outcome measure, whereas this isn't really relevant to most adults. Okay, and now we're going to move on to the second part of PICO, which is the intervention. So here are a bunch of examples of various different interventions, and you can see that there's enormous variation. It could be patient information, physiotherapy, some type of medication, vaccinations. So you can think about what you are interested in terms of the intervention. And at this point, I thought we could brainstorm. What factors do you think you should consider when defining your intervention? So if you think about an intervention that you're interested in, which factors might influence whether it's effective or not? So let's, if anyone has any ideas about this, you can just enter them into the chat room. I think I see some people typing, which is great to get us started. Ooh, okay, there's a lot down there. I wasn't scrolling down far enough. Okay, so now I'm going to move up a bit and see everything you've included. Effectiveness in previous studies. Yep, that's a good idea. Duration, side effects. Yeah, so duration, you could think about like the intensity or the magnitude or how many treatments a person is getting. Has it been documented before? Yeah, so you'd want to look at previous literature to get information about your intervention. Oh, and I see some really great descriptions of, or different factors that might influence an intervention, the type, the dosage, the intensity, duration. Exactly, so a lot of great ideas here. Okay, so I'm going to show you our list of possible characteristics of an intervention. And you've got probably most of these: intensity, delivery, timing, frequency. So obviously there's tons of variation in the types of different interventions. And then within the different types of interventions, there are a lot of different factors as well. So the specific, so whether you define your intervention very narrowly or not really depends on what it is. So say you're looking at a specific dose of a specific drug, then you can obviously be very specific when you're defining the intervention. However, if you're looking at a more complex multi-component intervention, then you will be less detailed in your description, allowing for expected variation in the literature. However, you'd still need to really hone in on what the core or common factors of your intervention are, and that's so you can identify it in the literature. And I'll give you an example from some work I'm doing right now. So I'm working with a team in Toronto, and we're updating one of our reviews, and of course it's on back pain. And the intervention is kind of complex. It's multidisciplinary biopsychosocial interventions for acute low back pain. And what we mean by multidisciplinary biopsychosocial is that the intervention must have both a psychological component and a physical component. So when we started to look for studies in the literature, you know, we found a lot of studies that met our inclusion criteria for the intervention. There would perhaps be a combination of psychological counseling and some type of physical intervention, maybe physiotherapy or exercise therapy. And we're like, okay, that's really clear. That meets our criteria. But there were other studies where it just wasn't as clear. Maybe you have a physiotherapist doing the physical component, and then the physiotherapist would also offer some coping advice for the pain. We're like, oh, is that multidisciplinary? It just wasn't quite as clear. So what we decided to do is to further specify our intervention by thinking about the personnel involved and their qualifications and training. And we decided that we would consider the intervention to be multidisciplinary as long as there was a team of professionals involved in the intervention, whether in the planning stage or the implementation stage. Okay, so you'll also want to keep factors such as location and context in mind as you think about your intervention. So does the intervention depend on specific equipment that may not be available in some places? Or do individuals implementing the intervention have the appropriate skills and training? Is the intervention affordable? Will people in rural settings be able to have access to the intervention? So the key point here is that the effectiveness of interventions may depend on some of these contextual factors. And you really just want to be aware of these things as you're considering your topic. Okay, so now we're moving on to the comparison aspect of your research question. Now, in many cases, you'll want to define your comparison intervention in just as much detail as you define your intervention of interest. So say you were looking at health professional versus peer-led interventions for mental illness. In this case, yeah, you would certainly want to provide a lot of detail about both the health professional and peer-led interventions. Whereas, say you were comparing health professional-led interventions to no intervention, well, then you'd have to explain, well, what do you mean by no intervention? Are they truly doing nothing? Or is it a placebo or usual care that they're comparing the intervention to? So you have to explain these things in detail and make your decisions up front. And you can also leave it open and say that you'll include any comparisons found in the literature. You just need to specify this ahead of time in your protocol. Okay, and now we're moving on to outcomes. And after we discuss outcomes, there'll be time for a little question and answer period. Okay, so outcomes are rarely part of the eligibility criteria. So think about this. All the other parts of the Pico statement, these help to inform your eligibility criteria, help you to make decisions about what studies will be included and excluded in your review, but not the outcomes in most cases. So they should be noted in your review, but they shouldn't be a deciding factor in whether a trial is included. And why is this the case? So excluding studies on the basis of outcomes reported may introduce bias. And this is because outcomes may be selectively reported by trial authors. Now, using the chat window, can anyone explain the meaning of outcome reporting bias? Outcome reporting bias. Any ideas? Yep, lack of negative results, reporting only the good results. Yep, great answers. That's exactly it. So in our definition, we say that outcome reporting bias is what outcomes with positive or significant findings are more likely to be fully reported in a paper. So if say you find a study that doesn't look at your outcomes of interest, instead of excluding the study, you might want to explore this further. So it's possible that the trial authors did look at these outcomes, but then they just didn't report them in their review. So then you have the opportunity to potentially gather more information. Now, all that said, there are certain circumstances where your outcomes will be a part of your eligibility criteria. So for instance, say you're looking at a prevention intervention. Well, you'd have to include studies that actually measured prevention. So in that case, the outcome would be a part of your eligibility criteria. Another instance is if the intervention that you're interested in is used for more than one condition. For instance, say you're looking at hormone replacement, and this can be used for cardiovascular disease and also for menopausal symptoms. So if you're interested in cardiovascular disease, then you could also obviously exclude the studies that focus on menopausal symptoms. So in this case, you really just need to, from the outset, define the review to cover a particular field of interest. So as you're choosing your outcomes, you want to make sure they are meaningful. Are they meaningful to patients? That's probably most important. And you always want to include possible adverse effects. And when you're thinking about your outcomes, you should also think about how they'll be measured in the primary studies. Are there valid, reliable, psychometrically sound measures of the outcome out there? And how is the outcome defined? You could also think of particular scales and time points. And I know I saw in the chat window that people discussing follow-up and the timing of the follow-up, and this should also be defined early on. So for instance, in one of our surgical reviews, the authors defined short-term follow-up as immediately post-op to 5 years, and long-term follow-up as 5 years or greater. Now that's a pretty long follow-up, and that wouldn't be a very good way to categorize the follow-up periods if you were looking at a different type of intervention, say dressings for the prevention of surgical site infection. In that case, you'd be more interested in more short-term follow-ups. And you also want to avoid trivial outcomes such as biochemical, surgical, and process outcomes. Now, in selecting your outcomes, you can gather information and consider core outcome sets that have already been developed. So these are key outcomes identified by a particular field. So for instance, we have a set in the back pain world that we guide authors to use in our method guidelines. And these outcomes include pain, function, overall improvement, and disability, which is often measured by return to work. So most of our authors include these outcomes. So what you could do is you could read relevant reviews and protocols related to your topic, and this could help you to decide on your outcomes that you'll be including in your review. If you also want to plan for selection among multiple similar outcomes, so say you're interested in obesity or overweight, you should think about the fact that you might find a trial where they measure body mass index, weight, and waist circumference. So these are all sort of getting at the same thing. So which outcome are you going to actually report in your review? Now, you don't want your choice to be influenced by the results of the study. So you should think ahead of time of which measure is most meaningful. Now finally, it's important outcomes should be included in the protocol and the review, whether or not data are likely to be found. So say you're really interested in mortality. You should include this even though it's a long-term outcome that few studies will measure. And I guess I'll just emphasize here that sometimes it's just as important to identify the gaps or the holes in the literature as it is to identify some type of treatment effect, as this can have a profound impact on clinicians' choices, and it could stimulate further research in a given area. Okay, so if you have multiple outcomes of interest, it's essential that you prioritize them in your review. So we usually ask authors to specify a maximum of 3 primary outcomes, and these will form the basis of your conclusions for the review. Secondary outcomes are also important, but they're considered of lower priority. And finally, we have another category called main outcomes, and this is a maximum of 7 outcomes that are considered essential for decision making. And they form the basis of analyses and summaries. So when someone goes into the Cochrane library to look for information on a health issue or an intervention, it's unlikely that most people will be reading the full review. Most people will be reading the abstract or the plain language summary or some type of summary of the review or synopsis. So it's important to decide ahead of time which outcomes will be included in these summaries. And I really think it is human nature to want to report the significant, more positive findings and leave out the null findings. So if you make the decisions in advance, you're more likely to communicate your results in a way that's non-biased. Okay, there are also some special outcomes to think about, and these are adverse effects, patient-reported outcomes, equity outcomes, economics, and qualitative outcomes. So I'm going to talk about the first 2, but the latter 3 I think you could probably get great information off the websites for the relevant methods groups, because some of these outcomes are quite new and up and coming. So adverse effects are included, they should be included in all Cochrane reviews now. So these are just harms or complications associated with a given intervention. And patient-reported outcomes are those outcomes that are self-reported. And we see a lot of these in the back group because we're measuring things like pain and function that only the patient really can report on him or herself. Now, the reason these outcomes are important is because there's a possibility that these self-reports can introduce bias into a study. So say you're in a trial and you're aware of the fact that you're being given some type of placebo pill, and then you're asked to rate your pain. Now, your ratings might be biased by the fact that you're aware of which group you've been randomized into. On the flip side, if you realize you've been randomized into the massage group, which you probably would be aware of, then this might have an influence on your rating as well. So this gets into issues of risk of bias and the blinding of allocation to the intervention group. And this is something, if you're going to be including patient-reported outcomes, probably a good idea to read the risk of bias section in the Cochrane Handbook, just to see how those outcomes play into your overall risk of bias ratings and assessment. Okay, so I've noticed that some questions came through, and this is when we can go through some questions that came up.
Yes, thank you very much, Teresa. There have been a couple of questions that have come through. From Maria, if I want to look at outcomes on patients, who is my population? This is a pretty broad question.
Sorry, outcomes on patients?
Yes. If I want to look at outcomes on patients, who is my population?
Okay, so the patients, would be the population. So yeah, you'd want to define your patient population a little bit further to define what the health condition is.
Can you perhaps offer an example?
Sure. Well, in our group, we could be looking at, we're often looking at individuals with chronic low back pain. So they are patients, and they're also our population of interest. And then we'd be assessing whether the intervention that we're looking at changes pain scores in that sample of individuals.
I know that previously you had mentioned the sort of immediate versus, say, chronic. So I'm sort of thinking of that too. Sometimes some people would want to look at, immediate outcomes following a back issue versus long-term or chronic care. So I guess you'd have to divide your population that way, perhaps, depending upon your question.
Yes, for sure. So yeah, because there are populations, some people have short-term back pain, and some people have long-term back pain, and some people have recurrent back pain. So these episodes that keep recurring, and depending on that, that would certainly inform the outcomes you're interested in, and also the length of your follow-up, whether you're going to follow over 2 years or 2 weeks, for instance.
Okay, thank you very much. Also, Hen says, does the primary outcome have to be patient-related?
That's a good question too. Yes, usually primary outcomes are patient important. And especially since they're included in all of the summaries that patients will likely be reading, then I would say yes, most definitely.
Okay, thank you. There is a question as well. This is Naria. She says, sorry, I'm repeating this. For the title registration, I am unsure about what to list under population if I want to look at training providers to look at outcomes for survivors of partner violence. Who is my population here? What if all the measures are very varied? Is a large category such as outcome for women survivors or healthcare providers' ability to respond okay? Is that a primary outcome, or should, only 3 subtypes of these be listed? I don't know if you got all that.
Yeah, from what I gather, it does sound quite broad. Yeah, could you maybe repeat the beginning part of the question, or I'll see if I can scroll and find it in the...
Certainly. It says, I am unsure about what to list under population if I want to look at training providers to look at outcomes for survivors of partner violence. Who is my population here?
Okay.
What if all the measures are very varied? Is a large variety such as outcome for women survivors. Or, in another instance, healthcare providers' ability to respond. Are either of these okay?
Okay, so this is
that the primary outcome?
Okay, so it sounds like your population could either be the healthcare providers, or it could be the people perhaps exposed to violence, the interpersonal violence. Does that sound okay? So if that's a helpful first part of the response, we can actually chat back and forth if you want to type more into the window. So yeah, so in some reviews, like in the EPOC group in Ottawa, all of their interventions are acting on something larger at the system level. So it could be an intervention for healthcare providers. So the healthcare providers, in a way, would be considered the population, as opposed to intervening on the patients directly. And then the second part of that question was related to outcomes. Eileen, would you be able to repeat the part about outcomes?
Sure, I certainly can. It talks about, let's see, what if all the measures are very varied? Is a large category such as outcome for women survivors. So that's one thing. Or healthcare providers' ability to respond. Okay. Is this a primary outcome, or should only 3 subtypes of these be listed?
Yes, I think you'd probably want to get into subtypes and just get a lot more specific than you are right now. Okay. So for instance, outcomes for women survivors, something like quality of life might be an important outcome, perhaps.
Okay, we'll move on to the next question. Is it worthwhile to do a review that will only identify 2 to 3 studies? And then do protocols ever get turned down because the population is too specific or the disease is too rare?
Well, this is another good question, and I think it depends on the review group that you're working with. So I know that a lot of review groups are even willing to publish empty reviews. So these are reviews that don't have any included studies because perhaps maybe there aren't any randomized controlled trials on that topic. In our group, in the back group, we like to write reviews if we can include 3 or more trials, but we're somewhat flexible in this regard as well. And it kind of goes back to what I was saying in the presentation, that showing the gaps or the holes in the literature can be just as important as identifying some kind of treatment effect. So I think if you're in the situation where it's quite a narrowly defined review, it's really important to communicate with the review group before you get started or as you're putting your title registration together.
Thank you very much, Teresa. Time for another question, perhaps? Can we explain why prevention reviews can have their outcomes considered?
Yeah, so it's because you'd have to actually measure prevention in the review. So we have some reviews on the prevention of reoccurrences of back pain. So people come into the study, they've had previous back pain, but they're doing okay right now. And then there's some type of intervention, say it's an exercise intervention. And then we follow them over time to see if they're more or less likely to have recurrences in the exercise group compared to the control group. And so the outcome you'd be looking at is a recurrence of back pain. And that's quite different from measuring, say, the degree of pain that you would be measuring if it was sort of more typical treatment review. Is that clear? I guess another example is the, oh, it does. That's good. That's good.
Okay. Okay, perhaps I've got a couple more questions, but perhaps we could move on and address these near the end. So if you'd like to continue, Teresa, that would be
For
great.
sure. Okay. So now that we've gone through the different components of a research question, another thing that will be determined as you're specifying your eligibility criteria are the types of study designs that will be included in your review. And you should select the most appropriate design for the question and always give a rationale for your choice. Now, who of you are under the impression that Cochrane Reviews only include randomized controlled trials? So you can write a little note in the chat window. So do Cochrane Reviews only include randomized controlled trials? Any ideas about this? No? Yep, that's true. Yep. A lot of, I would say the majority include only randomized controlled trials, but we're starting to be more flexible so that we can answer different types of questions. For instance, in our group, we tend to only do reviews of randomized controlled trials, but we have one team who is really interested in looking at surgical versus non-surgical interventions for adolescent scoliosis. So comparing things like a surgical intervention to something more conservative like bracing or exercise. In this case, a randomized controlled trial is pretty much impossible. It's not ethical to randomize an adolescent to surgery versus bracing. So because of that, the review group is including non-randomized studies with a control group because that's the best way to communicate the evidence to answer this question. Okay. So turning a question into a title. So you've seen this slide before. As I mentioned, there's a very specific format where you specify the intervention and then the health condition. So antibiotics for acute bronchitis, community-wide interventions for increasing physical activity. Now, depending on your topic, you might want to incorporate more information about various aspects from the Pico statement. For instance, if you're looking at preterm infants, you might want to provide that detail about the population. Oh, and here's this prevention of drowning topic. So this is a prevention review rather than a regular treatment review. So specifying this in the title is important. Same with a comparison. If you're only looking at comparing two very different or two specific interventions, this could be specified in the title as well as if you're looking at some special outcomes like improving maternal and infant outcomes, then this could also be integrated into the standard format. Okay, so now we have an opportunity to brainstorm a bit. So do you have a topic that you would like to turn into a question or a title? If so, you can either type in your topic, or if you've already turned it into a question, you can share that with us as well. Let's see, I'm not sure I see. Do we have anyone typing right now? If not, we might just move on and then we can talk about people's ideas and topics in the final question and answer period. Okay, I think we might do that because we're sort of running short on time anyway. But I just want to, before we move on, give you some practical tips as you're thinking about getting started on your review. As you know, you need to register your title with your Cochrane Review group. And I see a lot of proposals come in. So I just want to remind everyone that when you're submitting your title registration form, it is a proposal. So try to make a really strong case for your research question in that proposal. And in order to do this, just do your background reading. If you can read some of the published reviews from that review group in the Cochrane Library, I think that's really helpful. And read the individual websites of the review group that you're going to be working with, because there'll be some very helpful instructions. And if you can submit all the information that the review group wants right from the outset, it will save you a lot of time when it comes to getting the title registered. And remember that you're not alone in the process, because the editorial staff are always there to help you define your research question. Okay, so now we're on to the final part of the talk. So what to include in your protocol. And all of this flows quite naturally once you have specified your question in detail. So in your protocol, you're going to include background information about your condition and your intervention that you'll be looking at, and really make a case for why your review is important. And in the methods section, you will specify all of your criteria for considering studies for the review. So, and this will partly be based on the Pico statement. So you'll want to give a clear description of your eligibility criteria and a list of your planned outcome measures. And you'll also discuss data collection and analysis. And if you plan to do subgroup analysis, this is where you will discuss this as well. So for instance, we talked about the yoga intervention at the beginning of the webinar. And I was saying how, well, the impact of the yoga might depend on the specific type of yoga conducted. And because of that, you might want to conduct a subgroup analysis to really explore that variation. And we've already talked about eligibility criteria in depth. So these are the criteria you will use to make decisions about which studies will be included in your review and which studies will be excluded. And you want them to be really clear. You want them to be clear for your team so that when you're looking at all the possible trials, you'll just have a really easy, you'll just really easily and naturally be able to find which studies are the right fit for your review. And remember that any changes to the eligibility criteria after the protocol has been published needs justification in the review. And there's actually a place in the review where you can talk about any differences between the methods stated in the protocol and the actual methods used in the review. So take-home message, think through the scope of your review in detail before you begin, and use the Pico statement as a model to help you hone in on the various aspects of your research question. And use this information to determine clear and specific eligibility criteria. And finally, this information will also help determine your search strategy, data collection, and analysis. And I guess I would add the final take-home is the better you plan things in advance, the more smoothly your review writing process will be, and the less likely you are to introduce bias into the review process because everything will be so clearly defined from the outset. Okay, so this is a reference to the Cochrane handbook, and you'll have access to these slides, so you'll be able to follow this link. Okay, I think back to you, Eileen.
Thank you very much, Teresa. The materials used in this presentation, I just wanted to acknowledge this, have been materials developed by the Australasian Cochrane Centre and the Canadian Cochrane Centre. And of course, I would like to acknowledge the work of Miranda Kunston, who has been working on developing standardized resources for Cochrane collaboration training. So thank you very much for presenting, Teresa. We really appreciate it. And perhaps we can all give Teresa a round of applause for her time today, as well as the information she's provided. We do have time, I believe, for some questions. And as although I do have some already, I would like you to take a look at the evaluation form. The link is being sent to the chat room, and as we said, the evaluation forms are extremely important to us so that we are meeting your needs. So, questions. There are a few. Okay. See, can you talk more about meta-analysis? Which one would you think would be done and to benefit more to a practice? Don't know if that's really a topic for a different day.
It might be. What was the second part of the question? Which?
Says, can you talk more about meta-analysis? Which one would you think it would be done and benefit more to practice? Kind of a little fuzzy the way it was presented in the question.
Yeah, I think meta-analysis is definitely a huge topic, and probably be future webinars on the topic.
Mm-hmm. Ines, if you can clarify that, that would be great. If you are actually looking for more information on meta-analysis, you can find it in the Cochrane Handbook. And perhaps this should be a topic for a future webinar, too, as you mentioned, Teresa. Sarah said, let's see, no, I think that was pretty well settled. What is the outcome in a comparison of different kinds of patient information if there is no measurement of the effect that they have?
Different kinds of patient information. Okay, so say you were comparing a pamphlet versus information given directly by the physician face-to-face. So you would have two groups of people. One set of patients would be randomized to the pamphlet group, and the other set would be randomized to the physician interaction group. And then following the intervention, you would measure whatever outcomes of interest are relevant to your study. So for instance, if it was about the management of diabetes, then you could come up with some patient-important outcomes about how patients are managing their diabetes following the intervention to see which form of educational, or which method, I guess, was most effective. Is that clear? So it would really depend on your patient population.
Yeah, if you could indicate in the chat room, please, if that has helped to answer your question at least. Again, we have another question on meta-analysis. For a beginner, it is really hard to find a topic to do meta-analysis, even though understanding the theory, although understanding the theory quite well. Do you have any suggestions for beginners?
Okay, so I think, so are you asking that it's difficult to find resources, or it's difficult to find enough studies to actually be able to conduct the meta-analysis? Because that's an issue that comes up quite a lot in Cochrane Reviews, where maybe you only include 5 trials and you're not able to pool the results statistically. You have to pool them narratively. And for that reason, a lot of authors aren't even able to meta-analyze their findings. They have to do more of a narrative synthesis. But I do think that the handbook is a really good resource, and there's some really great workshops offered by the collaboration on how to conduct the meta-analysis. Okay.
There's also a question, and I had to re-ask this question. It appears that Ilaria was asking about, she said she was contacting an author, I assume from Cochrane, and she didn't receive any reply, but wanted to know about including a certain number of individuals. Am I able to get details? Should I lose some? But I was asking her if this was for her own research or not, and I suppose she would contact authors if she wants to seek more information on what sort of things when it comes to population in, say, a Cochrane review that she's looking at.
So what kind of information about the population would you want to gather if you were contacting authors?
I think so the number of individuals. So it has to do with, again, the population. I'm, again, I'm a little unclear the way it has been worded, and because it's to do with our own research versus Cochrane research, I'm not quite sure of the link, except for perhaps a gathering of information.
Well, and we talked about that in the webinar in regard to when you have mixed populations. So say 80% of the participants in the primary study meet your inclusion criteria, but 20% don't. That would be a reason to gather more information or get some individual patient data so that you can only include the participants in your review that are actually eligible according to your criteria.
Okay, and the final question here is, can we exclude the secondary outcome and be satisfied with a primary outcome?
That's an interesting question as well. I think if you can make a good case for it, it would certainly make the review easier to read. It would make it easier to write up the summaries. So I think if you can argue that the primary outcomes really tell the whole story, then I don't see why not. But that particular question is one that you would have to discuss with the review group that you're working with.
Okay. Well, thank you very much, Teresa. I think we've run out of time, definitely, and I'd like to thank everyone for joining us today, and thank you, Teresa, for joining us for this last in the webinar series. And we look forward to seeing you again at some of our other webinars. Please check on the Canadian Cochrane website under Education and Training. And if you have any suggestions for future webinars, please include them in the evaluation form, or in fact on you can always contact us through the website too. So thank you very much.
Thanks, Eileen.